these two brains or these two nervous systems are always communicating. Our GI tract is our kind of contact with the outside environment, but it's just inside. It's witchcraft. It's so crazy because if you told me I was going to do this a couple years ago, you told me I was nuts. I think my oldest son probably has Mast Cell Activation Syndrome, but I know that when he hits puberty, he'll be a lot more protected than if my daughter had Mast Cell.
The joys of being a woman. Yes, yes.
I know.
Welcome to the Uncover Your Eyes podcast. I'm your host, Dr. Meenal Agarwal. If you haven't already hit the follow or subscribe button, please do so. It helps us to bring you better episodes weekly. 40% of North Americans are suffering with a gastrointestinal disorder like IBS. Many of them are misdiagnosed, dismissed, or left with vague answers. Today's episode is with Dr. Zach Spiritos, a neurogastroenterologist who specializes in treating complex chronic GI conditions, especially in patients who are lost in the medical system. We're diving deep into the gut-brain connection, not just as a buzzword, but as a real biological relationship that could be the missing piece for so many patients. So if you've ever felt lost in the system, this episode is for you. Welcome, Zach. Thanks for being on today.
Yeah, my pleasure. I'm excited to be here.
So tell me, it's a heavy word. Like, how does a neurogastroenterologist differ from like that traditional, GI care that we get from a GI doctor?
Yeah, no, it's I don't love the name. I think we need to all come together and think of a new name that isn't like 17 syllables, but it's different in the sense that the traditional GI doctor will look within the tube of the GI tract and pay attention to the adjacent organs like the liver, the pancreas, the biliary tract. And we neuro-GIs will look at that, but we'll also get a sense of how the GI tract interacts with your peripheral and central nervous system. And so that not only means or entails the way the GI tract moves, because how our central nervous system heavily dictates how our GI tract moves, but also how it's perceived as well. So we talk about so a lot of the people that make their way to our clinic often have a lot of symptoms, but a lot of the diagnostic tests are normal, like the endoscopies, the CT scans, the ultrasounds. Sometimes their issues can be identified with motility testing, in terms of the way that the intestines moves or doesn't move. But oftentimes all their tests are completely normal because their symptoms derive from this foul play between the GI tract and the central nervous system, or the brain-gut connection, as we otherwise call it.
So talk to me about the brain connection. Talk to me about that nervous system, that connection. How are they connected? And how are things like stress? I've heard that stress can be, or when I feel anxious, sometimes I feel like I'm having gut issues, So how is that connected? And, sometimes we think, oh my God, I'm having gut issues, but really it's, brain issues. What is or mental health issues? What's the connection there? And how does that work?
Yeah. So we have our GI tract, which is that long tube that extends from our mouth to our rectum. And then right outside of it is our enteric nervous system, which is our second brain. And that, when our GI tract gets input from the outside world, which is typically what we eat, then it feeds that information up our spinal cord into our brain. And then our brain will then send signals back down to our GI tract to say, okay, well, we need to secrete more liquid into the GI tract to help with digestion, or we need to speed things up or slow things down based on what the GI tract is seeing. So they're continuously talking. So it's our enteric nervous system feeds up to our central nervous system, which then feeds back to our enteric nervous system. So these two brains or these two nervous systems are always communicating. And our GI tract informs our brain kind of what, our GI tract is our kind of contact with the outside environment, but it's just inside. So it's sending signals to our brain. But because that tract is linked, right? That is a circuit of communication that happens. When we are stressed or anxious, those signals also feed into our GI tract as well. And so When we're chronically stressed, chronically revved up, it can cause a lot of GI symptoms. We can completely shut down, right? So we have our autonomic nervous system, which is, there's two branches of that, which is our sympathetic nervous system, which is our fight, flight, or freeze. And then there's our parasympathetic nervous system, which is our rest and digest. And if we're so revved up all the time, we're not sleeping, we're drinking a lot of coffee, albeit too much coffee can give us diarrhea, but we're like really revved up and we're not paying enough attention to our mental health and taking care of ourselves, then we can get really backed up because we're living in this sympathetic overdrive. And our parasympathetic nervous system, which helps with digestion and moving food along and relaxing sphincters and helping intestines move along, that kind of shuts down. So we can get kind of chronically backed up. But at the same rate, if we have an acute bout of stress, then we can have diarrhea. If I give a big talk, I get the nervous poops, right? And so that's a real thing as well. So what
I
we
never
feel
thought about it like
yeah,
that.
and we have this big surge in adrenaline can really kind of lead to diarrhea, but it's not one to one like that. Everybody's kind of it's different interplay between how we feel emotionally or stress levels on our GI tract. Like it doesn't always add up like that. But then, you got to take into consider like hormones. Like hormones play a big role into our GI tract and how we feel. So, part of the neurogi's job is to kind of integrate all these factors along with your diet, how you sleep, to understand what's going on and potentially offer therapeutic options.
Very confusing to me, but walk me through, like, so say I'm an IBS patient or somebody, I have ulcerative colitis or Crohn's disease, and if I visited you, like, how would you see that in it through a different lens than, my regular doctor or my regular GI doctor? And what if I wasn't diagnosed with them? How misdiagnosed or whatever the situation is, how would you diagnose those things or know that it was being missed?
Yeah, I mean, so if you have something like ulcerative colitis or Crohn's, I mean, that's those we can see those abnormalities on CT scan, endoscopy, and so we want to treat the underlying condition, right? Which is some autoimmune process gone awry. So we use traditional therapies for that. That said, that even after you treat inflammatory bowel disease, some people have a lot of residual symptoms afterwards, which is called IBS, where we've treated everything, like on the CT scans, on the endoscopies, everything looks pristine, but people are like, I feel terrible. Like I get bloated, I have diarrhea, I have pain. So what's going on there? And that's usually that's called a functional condition, or where we're not really, there's symptoms, but yet we don't really can't see what's going on. So
Mhm.
from a pathophysiologic mechanism, it's some combination of subclinical inflammation that you can't see, dysbiosis, where the microbiome isn't as healthy as it should be, visceral hypersensitivity, to where the nerves from your gut to your brain are really fired up. So the normal churning and gurgling of your intestines, which otherwise should be imperceptible, you feel all of that. Um, yeah, and so those are the kind of the pathophysiologic mechanisms that are at play. So when we talk to people and we say, okay, you're having these symptoms, but that inflammation that was on your colon, if you had ulcerative colitis, is now gone. So why do you have these symptoms? So we kind of have to tease through the patterns of these symptoms to say what's driving it. Is it emotional stress? Is it just visceral hypersensitivity where things are moving fine and you're not necessarily stressed out, but you feel everything a lot more? And there's a lot of predictors for pain. A lot of people who don't sleep as well, or poor nights sleep really will predict pain the next day in your GI tract. So there's all these things that we can talk about to really set people up for success. But that's really like IBS care. And that's a different conversation altogether, because IBS is kind of it's not the best description of what's going on because it doesn't really tell us anything. And, IBS is really saying we're not quite sure what's going on, but you have a lot of symptoms. And so part of IBS is diagnosing what actually is happening from a pathophysiologic mechanism and giving targeted treatments. But generally speaking, it's targeting kind of mood, diet, stress, sleep, and targeted medications where we believe the issue is happening. Is it an issue with inflammation at the gut? Is it kind of where your brain is having a difficult time turning out pain signals? Do we need to use central neuromodulation? Is it something where cognitive behavioral therapy or hypnosis would be a good tool for you? So everybody's plan is so unique to them, kind of how they got there, what are their current symptoms, what they've tried, what their diet is, what their sleep is. So you kind of have to take, because all these variables play a role into what's going on.
So much holistic stuff nowadays, right? That's going into medicine. So, tell me, like, I hear about these symptoms so much more, like GI tract issues. And when I see patients, like, they fill out the history form, I don't really look at the GI stuff as much, but I see so many more people, being diagnosed, and I see so many people write medications down for GI issues. Um, why is there more of this? Do you think it's just more awareness and doctors? I mean, we've always had GI doctors, but you think people are actually visiting the GI doctor more? Or do you think because of mental health issues or environmental factors, we are just having more of them? What do you think is the root cause of this?
It's a lot. So I think it's a lot of things. I think everybody's stressed out. I think that plays a big role into our symptoms, how we perceive our symptoms. We know that stress plays a big role in our microbiome, and can alter that in and of itself. Um, there's a lot of chemical sensitivities as well. I see a lot of mast cell activation in my clinic, which is a whole different conversation. Um, and I think there's a lot of chemical sensitivity out there, whether there's just more volatile organic compounds around, and um, I don't know. There's also a lot of autoimmunity, right? There's a ton of autoimmunity, like where 50 years ago everybody was hospitalized for infectious etiologies and conditions. Now it's completely shifted to autoimmunity, and kind of and which is mast cell is a flavor of that as well. And so is that because our microbiomes aren't as fantastic as they used to be because of what we're eating? We're too stressed. Are there pesticides around that are kind of causing all sorts of havoc? I don't know. I think it's multifactorial. Um, but it's tough, and a lot of people are struggling these days.
Yeah.
And a lot of the treatments go back to the things that we know how to do: is eat well, sleep well, be with loved ones. But oftentimes we need medical therapies as well. Like, it's not that simple. Like, that's where the core of a lot of plans are made. But then, oftentimes we need to use medical therapy as well and really dig
Right.
deep into the microbiome and food and those kind of things.
I'm glad you kind of brought up the, what is it called? Mast Cell Activation Syndrome or something. I had never heard of it before. I actually just heard of it through your Instagram page. Can you explain that? And I noticed that you talk a lot about how either it's on the rise or you're seeing a lot of it. What is this syndrome, and how does it differ from regular, like, histamine sensitivity?
So I'll say every provider has seen mast cell in their life. It is not uncommon. And I got introduced to it about 2 to 3 years ago. So I was always seeing in my practice a lot of the refractory IBS patients. So these patients that had nausea, bloating, diarrhea, constipation, pain, and all the testing was normal. And we have a pretty good set of tools to treat these patients. But I had about like 40 or 50 people that just didn't play by the rules. They did not respond to traditional therapies that work for other folks with quote unquote IBS. They typically were women who were 20s, 30s, 40s, albeit, it ranges. They also had migraines and brain fog and fatigue and endometriosis and palpitations and POTS and allergies. And they always had like 11 subspecialists, and their allergy list was huge. And when I was in training, when you saw a patient whose allergy list was huge, they had, allergic to 20 medications, you say, oh, that person's off their rocker. No. And that's so now it's an ignorant way of thinking. It was just kind of the way my silly, dumb med student brain thought. We're like, oh, they're just difficult. But these people are just highly sensitive and reactive towards everything. But it's far more complex than that. It's a multi-organ, multi-system symptomatology that doesn't have any. We don't have any good tests for it. No FDA approved medications for it, but it's everywhere. And once I learned about MCAS, my life became a lot easier because I started to be able to make sense of these people that I otherwise didn't know how to think about, and they all fit the same pattern. And yeah, so clinically, it looks like a lot of symptoms in a lot of different organ groups: brain fog, fatigue, sinus issues, allergies with like normal allergy testing, IBS. They have, their heart races. They go to a cardiologist. They're diagnosed with inappropriate sinus tachycardia. They're like, oh, it's fine. Just take a beta blocker. A lot of men have endometriosis or PCOS, dysfunctional uterine bleeding. They have all these symptoms, and they see all these doctors, and they're like, oh, I don't know what's going on. Maybe try eating more fiber or getting outside and going on a jog. And they have mast cell activation. So
How do
it's
you treat this? Or, well, how do you diagnose that? Let's just talk about how we diagnose it.
Yeah, so I see a lot of it these days. And so fortunately, people have had all the testing first. So you kind of have to do your due diligence and run tests for, what else may be causing your brain fog and your migraines and your IBS and your tachycardia. You need to do your due diligence and do all the appropriate testing. That being said, these folks often have a lot of symptoms in a lot of different organ groups. So what's the clinical likelihood that they have 8 individual unrelated diagnoses? Like, it's just statistically unlikely. So that's kind of the phenotype that you see, or the presentation. It's just symptoms in a lot of different organ groups. So yes, they have to have testing first, which they often do, right? They go to their PCP and they say, go see a GI doctor. Oh, your heart's racing, go see a cardiologist. Oh, you have a lot of allergies and sinus, go see an allergist, and they get all the testing done. And generally speaking, a lot of the test is negative, or if it's positive, certainly doesn't explain the variety and the distribution of these symptoms. Like, you're like, oh, you have H. pylori, but like, does H. pylori cause all this? Like, absolutely not,
Hmm.
right?
Hmm.
Um, but you can also have other diagnoses and MCAS at the same time. A lot of people have atopic disorders and eczema and allergies, and so you don't. But yes, so they have to have some kind of testing first to make sure there's not a second and a primary explanation for these symptoms. And then once you're suspicious of it, we start to talk about testing, but testing is far from perfect. So we can traditionally, it was the tryptase level is what we tested for. Um, Tryptase is a horribly insensitive test. Less than 10% of the time you'll pick it up. And you kind of have to test during a flare. So you're asking someone who feels horrible to then drag their behind to a lab and they get testing done. Like, that's just insane. So we have other 24-hour kind of urinary collections that will check for biomarkers of mast cells. Not biomarkers, but one of the mediators that they secrete when they degranulate. And there's over 1,300 different chemical mediators that live within mast cells. That said, the half life of these chemical mediators are on the order of minutes, right? So
Yeah.
if you're not flaring, you won't catch it. Plus, the lab has to put it on ice and then send it somewhere. Like, for example, heparin is one of the mediators of mast cells. So these folks, these young women, often have dysfunctional uterine bleeding because these mast cells secrete heparin. That said, the half life of heparin is under 5 minutes. So you're just not be able to test for it unless you have a very savvy lab. So you can test for it, but the sensitivity still, operating with the presumption the lab does it correctly and it's cooled and sent to the right lab and yada yada, it's still around 50%. So it is still a diagnosis based on Gestalt. It's a putative diagnosis. And part of the diagnostic criteria, which there's some controversy around that as well, is response to therapy. And the good news is that although there's no FDA approved medications for mast cell activation, we use, there's various therapies that do work, and they're cheap and effective and have limited side effects. So a lot of it's trial and error, unfortunately.
Is there a genetic link to this, or is this an environmental thing? How are people getting this?
Yeah, so we think it's a mutation in the mast cells, and everybody has an idiosyncratic kind of mast cell experience. Like, some people have more kind of central nervous system symptoms with brain fog, fatigue. Some people are more like atopic, allergy, runny nose, stuffiness. A lot of people have like a ton of GI pain and can't eat, and we have them on feeding tubes while we, really treat their mast cell activation syndrome. It can be really, really bad. In fact, a lot of eating disorder clinics are screening for mast cell activation up front because patients
Oh.
deemed like anorexic just have a horrible time eating. A lot of these patients hate eating, is what they tell me all the time, is because everything feels terrible and they react to a lot of them, not only like in their GI tract, but flushing, fatigue, whatever.
Right.
But yeah, so going back to the original question, is we think that these are idiosyncratic somatic mutations in the mast cells. So things that aren't necessarily, um, not necessarily you're born with, but you develop over time. Um, but there is a kind of certain person that gets this, and it's mainly women. We think that testosterone is rather protective, over mast cells. I think my oldest son probably has mast cell activation syndrome, but I know that when he hits puberty, he'll be a lot more protected than if my daughter had mast cell. Estrogen tends to be a lot more, cause these mast cells to be a little bit more
The
finicky.
joys of being a woman. Yes, yes.
I know, I know. And there's the autoimmune. There's a lot of comorbid autoimmunity. So a lot of my patients with mast cell also have autoimmune conditions, and if you treat their autoimmune conditions, their mast cell gets better. So And then a lot of people are bendy or have Ehlers-Danlos. So I see a ton of people with hypermobility. People with hypermobility tend to have some predisposition for mast cell activation syndrome. But there's theories as to why that happens. But I think if you go to a conference, there's 10 different people that have 10 different answers for that. But we just see it a lot. Um, and patients with dysautonomia have a lot of mast cell activation as well. So otherwise, people who have postural orthostatic tachycardia syndrome or POTS. But to answer your question, we don't know what caused this. We think there's some idiosyncratic somatic mutation on mast cells that if you were to test for that and then treat it, you could develop treatments. But we're so far from that. We're just effectively using medications to stabilize mast cells, but there's no rhyme or reason to what we do. I think everybody has a different algorithm for this, and I have 200-page algorithm that I've devised, but I'm humbled every day by this condition because I tell my patients, like, there's a ton of uncertainty here. Like, I am,
Yeah. Yeah.
I read, all I do is read and think about mast cell activation syndrome and these challenging conditions, but it's really challenging.
So this mutation, tell me how that works in our body. So the mast cells they're mutated, and how are they responding then? Are they responding hyperactively responding, or they're not responding?
Yeah, so let's get back to what mast cells are. So mast cells are part of our, like, the first line of defense. They're part of our innate immune system, and their job is to survey the environment, look for breaks in our skin to the presence of viruses, bacteria, fungus, changes in hormones, pressure, temperature, smells, scents, chemicals. So they sense the environment and react appropriately, and they have 1,300 chemical mediators that they secrete uh, at the right time, at the right amount to stimuli. But in mast cell activation syndrome, they're constitutively turned on and have a much lower threshold to degranulate. So there's usually the kind of baseline level of symptoms, which, to talk about tryptase really quickly, that test, they say you want to go during a flare. I don't know any MCAS patient that is completely at baseline and then flares. There's always some low level of symptomatology, whether it's
Okay.
like brain fog, fatigue, bloating, loose stools. But then when it flares, it gets really bad, and they have to lay down. They get migraines. They itch. They get hives. They go into anaphylactic shock. And so these mast cells are just very twitchy, and at the drop of a hat can degranulate and secrete all of their chemical mediators that have humongous, tremendous downstream effects in terms of our symptoms. And at the worst, it's anaphylactic shock. And it could be to nothing. It could be to how hot it is outside. It could be to exercise. It could be due scents seem to really trigger mast cells. So if you walk, those Hollister stores in the mall that it smells like cologne, they walk past that and they go into anaphylactic shock. And so that's the most extreme end of this. But it's really just, they're very twitchy and have a very low threshold to degranulate.
How many people have this? Like, what is there a general stat on this?
So people think that it's up towards like 20 to 30%. I don't have any way to validate that, right? So I like take that with a humongous grain of salt, but I think it's definitely underrecognized. Um, like, for example, I'll take my 6-year-old son, right? He has all sorts of weird symptoms. He's got a weird symptom in his penis that he feels like he needs to go to the bathroom and nothing's there, and he gets checked by the doctor and it's nothing there. It's like, oh, it's fine. It's behavioral. What does that mean? It's behavioral. We just can't measure it. We can't test for it. He's also
Right.
really itchy. He has dramatic graphism, which means that you do this on his arm and a little red line raises up. And what I guess I'm trying to say is that these people kind of live with, they're comfortable with being uncomfortable. And there's always this
Right.
background noise of symptomatology that like doesn't really equate to any diagnosis in their youth. Like they have like just their tummy hurts a little bit more sensitive, and they're like, oh, he's just sensitive. And then something happens, like COVID or a vaccine or pregnancy or hormones. And then things start to get worse. And then over time, it can start to kind of get worse until you start paying attention to triggers and stabilizing the mast cells. But there are people that present to my clinic who definitely have mast cell, and they've seen a million doctors, and they've been to all the hospitals, have all the testing done, and they're really, really sick. And then there's people that I think are a little bit more kind of have always just been labeled like a little bit more sensitive. Like they get a tummy ache every so often, or
Yeah.
stress really bothers them. Like I get stressed all the time, but I don't get hives and fatigue afterwards. But I think a lot of people just live with it because they go to their PCP and they're just like, I don't know. Like, oh, but everything's fine. Your TSH is fine. You're not anemic. You've had your colonoscopy. Like, I don't know what it is, but it's not cancer. So So I think it's more prevalent than we know. And I think it's getting worse with all of, I'm traditionally trained, like went to Duke, but I don't know. I didn't get taught about the environment and how things affect us. And I really do think now that I'm seeing this is that, there's chemicals everywhere from our nonstick pans to new mattresses to dust mites. Like there's stuff everywhere. And I think, to go back to these sensitivities, like breast implant illness, which I don't know if you've heard of before, people get systemic symptoms after getting their breast implants.
Yeah, yeah.
There's a huge patient population out there who experiences this, and they've kind of been poo-pooed as like, oh, it's just nothing, like sick anxiety. Like, no way. And now there's surgeons that are explanting these and realizing there's lots of mast cells in these capsules that they take out. And so that's a part of this. It's like, oh, they're just anxious. Like it's just they're sensitive. And that's what mast cell is, and there's various degrees of that. In fact, there's this thing called post-cholecystectomy syndrome. That's kind of this, I don't even know what it is. It's not really a diagnosis. People that get their gallbladder taken out for symptoms, right? Because they have a stone in there, but it's actually not really causing their symptoms. And then they still have this pain, but it's even worse. And it's reactivity to the clip that's left behind. And these patients often have like they historically have a reaction to like nickel and jewelry. And then you leave that clip behind. And now it's this nidus for mast cell activation in their body. So it's just we just, for whatever reason, and I can't tell you why, we're reacting more and more to the environment, whether it's us and it's our microbiome or it's the environment, probably a little bit of both. I don't know. But I fear that this is only going to get worse over time. And hopefully that leads to our
Yeah.
knowledge of this and we start making FDA approved medications for this. But I still think we're far off from this. I don't want to start kind of this thing like everybody's going to get it. It's going to be horrible. But it's something that I didn't
We
learn
need to be
about.
aware of. Yeah.
Yeah. And I was in training too long ago. I didn't hear anything about this. And now it's almost my entire world.
So, I mean, I'm a big, advocate for self advocacy because I've gone through as a patient the healthcare system. And that's how this podcast was born. My frustration, kind of what you were talking about with these patients, with the healthcare system, and knowing about these syndromes to self advocate. So, if I'm a patient, and I'm sure there's many listeners that, are probably experiencing some of the symptoms you're talking about, and we've gone through the system where we are explaining to our doctors that these are our symptoms. They have tested us, with whether it's a colonoscopy, whether it's whatever lab work they need to be have, or seeing the cardiologist. Like, how do we know that we now need to advocate for ourselves to go see who and do what?
Well, it all, I guess it all depends on what your symptoms are, but you need to find a doctor that has your back. And what that means is that even if they don't know the answers, they're willing to fight for you and be curious with you and say, okay, you're feeling XYZ symptom and we've run all the tests and I know that's normal. We're not just going to write this off. We're going to continue to dig and fight. And whether that's talking to other people, looking online, a lot of my patients have found direction on kind of groups on social media where they read about their symptoms. Like, man, this sounds a whole lot like POTS, or this sounds like mast cell activation syndrome. And then they find other people in their community that may have similar symptoms or presuppositions of this is what's going on. And then they kind of point them in the right direction of their care team. Because there's unfortunately not a great website or a great directory of providers that kind of openly treat this. I don't think there's many out there, to be honest with you, or comfortable doing so. TMS is a great website. It's a mast cell website, but I've heard that a lot of people kind of found their care teams through social media and Facebook groups and the like. But to go back to your question, it's finding a provider that will fight for you and will believe you and be curious with you to understand what's going on.
Which is very difficult nowadays. You know, I I think I saw somewhere, I want to say it was your Instagram again, not that I'm stalking you, but you were treating a patient and she was experiencing hair loss, I want to say. Does this sound familiar? Was it from yours? Yeah.
Sorry, yes.
And yeah, and you added a, mast cell stabilizer or something in her shampoo.
Mhm.
What does that mean? Like, what are we adding to the shampoo? We're all gonna go out and get the shampoo. No, I'm kidding.
No,
But,
it's
obviously,
absolutely,
if they have this, what
it's
are you adding?
it's witchcraft. It's so crazy because if you told me I was going to do this a couple years ago, you told me I was nuts. And before I saw her, and to be fair, she is amazing woman, and she's been through it. By the time she saw me, she was on like hormone replacement therapy. Not saying that's, I mean, that actually makes sense for a lot of postmenopausal women. She happens to be postmenopausal. And she was on like a million different diets, and she has all the testing run, and she felt terrible and was losing her hair and had flushing and bloating and tachycardia, and her heart would pound out of her head when she put her head on the pillow. She was on all the antidepressants. Nothing worked. She's tried everything. And she's had all the vitamin and micronutrient deficiency panels run, and nothing was there. All the testing was completely normal. And so we talked about it, and she came to me for her GI symptoms. And I was like, immediately, I was like, you have mast cell activation syndrome. Just she had all the symptoms. And we started to run some therapy, and some things got better. But the thing that really bothered her the most was her hair loss. And so I can't say that I learned this myself, but Dr. Larry Afrin, who has written the book on mast cell activation syndrome, fortunately, I'm able to communicate with him. And one of the tricks that he taught me was cromolyn in the shampoo. So cromolyn is a medication that is a mast cell stabilizer.
Yeah, yeah.
And we use it a lot for inhaled cromolyn for allergic type disorders. It only really works where you apply it. It doesn't get systemically absorbed. So for GI mast cell, we can sometimes use it, but it just really works in the GI tract. And so if you apply it to rashes, there's another condition called vulvodynia, where the vestibule in the vagina is really, really, really sensitive, and we think that's a mast cell driven process. You can put cromolyn on a douche, and it works for that. But it also works for hair loss. And so I actually was able to see her yesterday, and her hair looks fantastic. It's almost all grown back. And so there's no protocol for this, right? I'm completely making this up. This is not,
Yeah,
there's no
yeah,
randomized
yeah,
controlled trials for this. Inherently, I get very uncomfortable as a traditionally trained guy recommending these things, but there's nothing else. Like, one, it's
yeah.
a pretty benign intervention. There's no promise it's going to work, but cromolyn's a pretty darn cheap medication, and it doesn't really have any side effects. So, I asked her to put 5 milliliters or 100 milligrams in her shampoo and use it every day. And I think we started it in April, and
Wow.
her hair is completely back. And we're still fighting, we're putting out some other fires in other parts of her body. And the treatment plan is still evolving, but that was a huge one because that really affected her quality of
That's
life.
life changing. Yeah, absolutely. And what about pregnancy? So I noticed that you mentioned something about pregnancy, that when you're pregnant, a lot of women will find out that they have this mast cell activation syndrome, or is it that it gets better?
Yeah. So during pregnancy, it often gets better, but not everybody. I don't want to paint with a broad brush here, but generally speaking, it does because the progesterone tends to be more stabilizing. Do you kind of get that rise in progesterone during pregnancy? But some people have had like background mast cell type symptoms, just like background noise, like food sensitivities, or you drink and you flush a lot and you get itchy and you have a lot of sinus issues and kind of IBS as a kid, or have always been constipated. And then as soon as, in the postpartum period, they develop mast cell activation syndrome. I can't explain it. But it's one of the inciting triggers for mast cell getting worse. So, a big illness is probably the number one thing that I see. This kind of hormones is another one. So when women start puberty is another one. Postpartum is another one. Vaccines is another one. But it's just one of the kind of hits to the system that for some reason
Right.
triggers a susceptible mast cell to become more inflammatory.
Are there certain foods that are triggers to this?
Everybody's different. Some people have, food really makes their mast cell worse. Some people, it's the environment. And so the diet that we typically recommend, and again, there's no data for this. I'm always a little bit nervous. This is all anecdotal. Is
We'll
gluten.
put a disclaimer there. Don't worry, Zach.
I don't want this to seem like there's so much uncertainty here, but a
Yeah.
lot of it is history taking and seeing what
Right.
people's history have been. But a lot of people will find that they eliminate gluten and they feel a lot better. And it primarily improves their neurocognitive function, like the brain fog and the fatigue and migraines as well. So I find even in people who do not have celiac disease, um, And so that begs the question for people that have, there's a separate entity, which is non-celiac gluten sensitivity, where people eat gluten and feel terrible, brain fog, fatigue, joint pain. Like, do they have a variant of mast cell activation syndrome? Because this has been this kind of nebulous thing that was like, oh, they eat gluten, they feel terrible, but there's no biomarker to kind of to show how miserable these people feel or why they feel so miserable. And maybe this is a mast cell driven process. But we're kind of realizing that all these different things that are idiopathic, like interstitial cystitis, which are like, I don't know, but it's not a UTI, and try some amitriptyline, maybe that'll get better. Like that actually gets better with mast cell driven therapy as well. Um, so I'm sorry, what was your question? I kind of got on a
I know,
tangent.
but that was me. Like what you just said, like I got so because that was me.
Oh,
That
gluten.
that is me. The gluten thing is me.
Yeah.
If I eat a lot of gluten, I've been tested and I'm fine, but I know my own body if I eat a lot of gluten. I mean, I'm talking even like, 3, 4 pieces of bread. If I have 2 sandwiches a day, I will feel exactly what you said. So I wonder if I have a mild variation of this, but it's interesting like to see that because I myself have cut down my gluten for that reason because I know it makes me feel terrible.
Yeah, and I wonder why that is. Does it increase your intestinal permeability, so you have more like leakiness, and that triggers mast cells in the, does what leaks across that and causes inflammation in the brain? I don't know, but we do see that a gluten-free diet does help, not for everybody, but for a lot of people. A low histamine diet tends to help as well, just because it decreases your histamine load, and histamine is one of the chemicals that mast cells secrete. So just decreasing your histamine load is often helpful, but not always. So I wouldn't, a lot of these poor patients are just so limited already in what they can eat because they have these allergic reactions that don't actually show up on testing. So they eat something, watermelon, and they get horribly itchy or God forbid, anaphylactic, but their IgE testing is normal. So they're like, well, I don't know, like you just eat less of it. I don't know what to tell you. So they're already horribly limited in terms of their diet. And so imposing more restrictions can actually be counterproductive. So I think you just kind of have to take it on a case by case basis. And if someone's eating a lot of histamine foods and they realize that, oh goodness, I feel terrible afterwards, then I would start dialing those back. But it is a really tricky diet to follow. So I would always partner with a dietitian when doing that because it is like a low FODMAP diet, just really intimidating, and it can lead to more issues if it's not done carefully.
It's so interesting. You said like medicine, you were just making a concoction, right? I feel like medicine is becoming like that, where before it was like, I have this rash, give me this, or I have this, this cold, give me this antibiotic. But now it's like it's not as simple as that. Doctors have to think and they have to figure things out, and people have more symptoms than just a cold. And it's interesting how medicine is not so much about what we were trained in, but more about what you're learning now as you're practicing. So I love that. What are some myths that you feel so many patients come in with about the brain gut connection?
Like when people, a lot of times people say, or, they'll have a lot of symptoms and they go get a colonoscopy or an endoscopy or CT scan. Like, this isn't, this is there must be stress. Just try to manage your stress. And I hate that because it puts it on the patient. It's like, you're doing something wrong. Like, you need to fix this. It's like, no, I get stressed out all the time. I still have panic attacks to this day. I don't have IBS. It's not just stress. It's stress in combination with gut inflammation and microbiome changes and hypersensitivity. So it's, yes, decreasing your stress will help, but this is not on you. This is not your fault. You are not doing anything. We are just limited by the ability to accurately detect what's going on a lot. That doesn't mean that we shouldn't work on stress management and trying to get the best sleep possible and spending time with loved ones, but it is more complex than that and deserves a plan tailored towards you. And this is not in your head.
Thank you so much for telling us that. Yeah, because like a lot of the time we're told it's all in our head, and you're right. So thank you, Zach. I really appreciate your time today. Can you tell our listeners where they can find you?
Yeah, so you can find me on my Instagram account, Dr. Zach Spiritos. I'm also on TikTok as well. We just kind of made that move. I also have a clinic, Ever Better Medicine, where you can be seen if you are in the state of North Carolina or Illinois at the time of the visit. We treat disorders of the brain-gut interaction, motility disorders, really challenging gastroparesis, constipation, diarrhea, like unclear, very bothersome GI symptoms. We treat dysautonomia as well, including postural orthostatic tachycardia syndrome and mast cell activation as well. We are very adept at kind of understanding or the challenges, the unique challenge that people with hypermobility face as well. So we can address those too. So if you're interested, we'd love to see you. You can find more about that online.
That's so great. Thank you, Zach, for your time today.
Oh, absolutely. Thanks for having me.
Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at dr.Meenal Agarwal. Until next time, keep those eyes uncovered.